Good evening to everyone. Today's topic is osteoarthritis. I'll just introduce myself in short. I'm Dr. Pranoti Kangutkar. I'm a master's in sports physiotherapy, and I'm on this post of state president for Maharashtra for GAPT. So we'll start with our today's topic without wasting any time. Guys, please also make sure that you enter the meeting with your name. Yeah, so let's start with this. As I mentioned before, that our topic is osteoarthritis for the day. The presentation will be have a content of definition, causes, signs and symptoms, diagnosis, stages of OA, and we'll discuss about knee OA in physiotherapy point of view. So let's start with the definition. According to the definition of osteoarthritis, arthritis that occurs when flexible tissue at the ends of bones wear down. The wearing down of the protective tissue at the ends of the bone, that is the cartilage, occurs gradually and worsens over time. So I won't read overall, and I'll also share this PPT with you all in the other groups. So to define osteoarthritis in short is basically the cartilage which is present between two bones, between a jaw or between a joint. It ends up being into wear and tear at the end of the tissue. So what happens? Both the bones ends up having a friction between each other, which at the end leads to osteoarthritis. And probably osteoarthritis and joint pain is mostly found in the proximal areas. That is, as you can see, it's mentioned like neck, lower back, knees or the hips. But most probably it is found in the proximal area like fingers of the hands, of the toes, of the foot. And it moves from proximal to the distal area. Now, causes for osteoarthritis can be several. Here are some mentioned, but I'll discuss the most causes. First is older age. As you know, also when a patient above 50 or above 60, the risk of osteoarthritis increases. Mostly the risk is more in women than compared to men. Obesity is another factor. Also, joint injuries. Now, joint injuries, I would like to tell you, injuries such as those that occur when playing sports. Okay, if a particular joint is getting injured again and again, that joint is more risk to osteoarthritis. Also, repetitive stress on the joint can lead to osteoarthritis. Some people have it genetically, like if there is a family history of osteoarthritis, then of course, you that if we have, if there is history of osteoarthritis, then of course osteoarthritis can be prevented. Malformed joints. For example, most of the time it is seen that there are vulnar or valgus in knee. Such people are also more prone to osteoarthritis. And the last one which you are reading, that this includes diabetes and a condition in which your body has too much iron. It is a very dread thing. So it is one of the last causes for osteoarthritis. Next is signs and symptoms. So when a patient enters your cabin having a osteoarthritis, this will be the common signs and symptoms in there. First will be pain. Of course, pain will be present anywhere where there is an injury. There will be stiffness of the joint. comes with knee osteoarthritis, the range of motion of knee flexion will be compared to the normal range. Grating sensation is related to the popping and cracking sound. There will be bone spurs. Bone spurs aren't that common, but yeah, it can be seen in some patients. Swelling, of course, it will be present. As if a patient having knee osteoarthritis is obese also and is continuously using the joint, then there can be injury inside the joint, which can ultimately leads to swelling. So these are the basic signs and symptoms. Pain, stiffness, swelling, and tenderness are common of it. Next, coming to diagnosis. The most common diagnosis are the X-ray and MRI. In X-ray, cartilage won't show up, but if bones are causing friction against each other, then some of the wear and tear of the bones can be seen in the X-ray. If X-ray doesn't show any bone spurs or any injury to the bones, then MRI is done. MRI is magnetic resonance in imaging. It is not that commonly used to diagnose osteoarthritis, but if it is a complex thing, then MRI can be provided. Also, lab tests are done, but most of the lab tests, like a blood test or any joint fluid analysis, are not available to detect osteoarthritis, but they can be useful to compare the other diseases to osteoarthritis. For example, a patient can also have pain due to gout or some rheumatoid arthritis. So blood test can differ if it is actually osteoarthritis or it is some other injury the patient is having. Coming to the stages of osteoarthritis. Stages of osteoarthritis are from 0 to 4. 0 is pre-osteoarthritis. 1 is early or doubtful. 2 is minimal. 3 is moderate. And 4th is severe. We will discuss this. Stage 1. Stage 0, as it is pre-osteoarthritis. So basically, there is no signs and symptoms of OA, sorry. Stage 1, which is said to be early or doubtful, as it is written over here, stage 0 is considered pre-osteoarthritis and describes a normal healthy joint. However, this stage can also describe an early stage of OA when damage is beginning to occur on a cellular level without any clinical or signs and symptoms. Okay, so the stage 1, it is written as stage 0. I'm so sorry for that, but it is considered to be stage 1, where it can be where osteoarthritis can be doubtful. There are no proper diagnosis of the same. Stage 2 comes down when it can be mild or minimal. A, a doctor can ask the patient to go for an X-ray for any bone spurs or other problems. The X-ray may show bone spurs if it is a mild stage, if it is a mild OA, that is if it is a stage 2 OA. So diagnosis completely relies on your assessment also. And in stage 2, the treatment will be mostly considered for pain. If there is any swelling present, some of the other medications can be given. The patient or some low impact exercises. But as it is a mild to it is a stage 2 where it is mild or minimal, no proper osteoarthritis can be taken into consideration. You can also ask the patient to use knee support while climbing down a staircase. Stage 3 is moderate. Now, moderate is where actually the cartilage between the bone begins to show some signs. The space between joints become visibly narrower, more bone spurs may develop, and they can enlarge. Okay, signs and symptoms can be pain while walking, moving, or doing any other activities. Stiffness can worsen in the morning, and prolonged sitting can lead to swelling. Diagnosis is as usual. X-ray can be done. Okay. Also, a proper assessment can be taken. Arthroscopy, a minimal invasive procedure, may be used in the diagnosis as well. Diagnosis arthroscopy involves insertion of a small scope in the joint to examine the joint. Treatment, as said, first it will be the NSAIDs for pain. If there are not enough, a practitioner may prescribe pain medication to the patient. You may need, or I won't discuss the medication in details, but yeah, some of the other steroid injections is given for joint pain relief. Lifestyle changes like losing weight and exercising can be recommended to the patient. And at the stage 3, mostly the patient is referred to the physiotherapy. Stage 4 is now where the osteoarthritis has reached to its severe stage. The amount of cartilage in the affected joints in stage 4 is much lower, and in some cases, it may be completely gone. Okay. Signs and symptoms will be as usual. There will be pain in the affected area. The ADL, that is the daily living activity, will be difficult or completely impossible. Stiffness and swelling and inflammation can also be severe. Diagnosis is at same. Diagnosis relies on symptoms, physical examination, X-ray. Treatment at stage 4 is non-invasive treatment most probably, and life changes can be recommended, but these are not the only thing. The ortho can recommend for some bone realignment surgery to reduce pain. Arthroplasty or knee replacement surgery is most of the common suggestion given to the patient. And the last thing comes is physiotherapy. But before going for any surgery, the ortho will recommend uh, physiotherapy for the patient. If physiotherapy also doesn't work, and if it is more severe, then the patient has to go for a knee replacement. This is a common physiotherapy protocol which we follow for osteoarthritis. So, in a case where a adult of 45-year-old female has come down to your clinic with intensity of the pain. According to the intensity of the pain, first thing you will do is to to provide a modality to the patient. Most probably the modality used are diathermy and IFT. We have considered knee joint for this. Okay. So SWD and IFT are the most commonly used for osteoarthritis. SWD is sometimes contraindicated depending on the medical history of the patient. When you start with the exercises, you need to start with basic. For example, ATM, isometrics of quads, hams, and glutes. ATM is ankle to movement. Coming to day 2 and day 3, you're supposed to follow the above protocol. Modality, ATM, isometrics of quads, glutes, and hams. Coming to the day 4 and day 5, you need to follow the above protocol and start with strengthening with therabands or weight cuff, depending upon the patient's pain intensity. If a patient is complaining to you that there is pain, I would recommend personally that don't go for strengthening. You need to start with the same. You need to follow the same protocol which we followed on day 1 and day 2. That is the basic modalities, IFT and SWD, and the basic exercises. So the basic exercises which you can increase is ankle toe movement, isometrics of quads, hams, and glutes, SLR, side SLR, bedside SLR, cord strengthening. So this will be the basic protocol which you need to follow. And once the patient is it's okay with the pain, or the pain intensity has reduced depending on the visual scale, then you can start with the strengthening. So this is the basic protocol which we follow for osteoarthritis of the knee. Yeah, so this was completely a basic go through for osteoarthritis. If there are any doubt regarding the same, you can put it in the group. I'll also share this PPT with you all in the group. If this webinar will also go live on YouTube, so you can put your comments over there also. Thank you.